Hi, I'm Dr. Tamar Kessel, and today I will be talking about genicular nerve ablation of the knee. So osteoarthritis of the knee is a very big problem. 33 to 85% of people older than 55 exhibit radiographic evidence of knee arthritis. All-cause knee pain is present in 20 to 30% of those 65 and up. And knee pain affects 250 million people worldwide, and that number is only expected to go up as the population ages and knee pain from arthritis becomes more common. So what are some of the risk factors? So high body mass index. We know that every pound that we carry extra is like 4 pounds through our joints. Previous joint injury, occupational hazards that place excessive mechanical stress on the knee joint, structural misalignments, and we know that chronic knee pain leads to disability, psychological distress, and impaired quality of life. So what are some of the signs and symptoms? So pain that increases with activity, improves with rest, swelling of the joint, feeling of warmth in the joint, stiffness, especially in the morning or after a period of inactivity, crepitus, or what people call creaky joints, as well as decreased range of motion. These are all signs of arthritis of the knee. So what are some of the treatment options? So some of our first-line treatment options include physical therapy, so strengthening above and below the joint. We know the stronger you get the muscles above and below the joint, less pressure through the joint, less pain. We have anti-inflammatory drugs, so things like Advil and Aleve, these can help reduce pain. There are injections, so steroids or hyaluronic acid. Hyaluronic acid people also refer to as gel shots. There's also more regenerative type injections, things like platelet-rich plasma and stem cells. And for people who have severe pain or people who've failed to respond to more conservative treatments, there is obviously surgery, which would be a knee replacement. However, we all know that surgeries have both perioperative and postoperative risks, including development of chronic pain as well as limited implant longevity. And in addition, not all patients are actually candidates for knee replacement surgery, either being too young, too old, high body mass index, or medical comorbidities. So all treatment options, they do come with risks. So while things like nonsteroidal anti-inflammatories do help manage pain, we do know that they're associated with significant risks, including gastric bleeding or increased cardiovascular events. Duloxetine, also known as Cymbalta, is FDA approved for treatment of musculoskeletal pain, so you can consider using Cymbalta for people with knee arthritis. And then there's the use of opioids, which we know have many, many side effects, including dependence, tolerance, hyperalgesia, endocrine imbalance, and addiction. So I'm sure we are all aware of the opioid crisis we currently have here in this country as well as worldwide. So because of the lack of optimal treatment options, we're always looking for alternative methods of treatment for people with knee arthritis. A relatively novel option is radiofrequency ablation of the genicular nerves, which I'm going to talk about. Radiofrequency ablation, you can think of it as heating up or killing the nerve to the joint. Genicular nerves, these are purely sensory nerves, and they arise from branches of the tibial and common peroneal nerves. So the tibial nerve gives rise to the superior and inferior medial genicular nerves, and the common peroneal nerve gives rise to the superior lateral and inferior lateral genicular nerve. So here is a picture of these nerves. So you could see that the tibial nerve gives rise to the superior medial genicular nerve here, and the superior medial genicular nerve over here. And the common peroneal nerve gives rise to the inferior lateral genicular nerve and the inferior medial genicular nerve. So again, these are purely sensory nerves. The idea of the ablation is we heat up or we kill these sensory nerves to the joint, which should reduce pain. This nerve over here we avoid in the ablation because you could see the peroneal nerve lies very close to it. So if we inadvertently ablate that motor nerve, you could potentially cause a foot drop, which we would like to avoid, obviously. So what are the indications for genicular nerve blocks? So patients with chronic knee pain secondary to arthritis, people who failed conservative treatment, so maybe you tried physical therapy, you tried injections, they're still having pain, ablation is an option. People who failed knee replacement, so there are people who've had knee replacements and they still have pain even after the replacement, and you can consider an ablation in those cases. People who are unfit for knee replacement, either too young, too old, comorbidities, and then there are people who just want to avoid surgery. So Before you go ahead and do an ablation, you want to make sure that it's going to work. So that's when we do a genicular nerve block, and that's where with x-ray guidance, we just numb the nerves to the joint. So we put lidocaine along those genicular nerves, and we have people keep track of their pain relief for 6 hours. If in those 6 hours they feel at least 50% better or more, then they would be considered a candidate for the ablation. And you can see down here, this is a picture of the ablation machine. So you can see that these are the electrodes. So these are the needles over here, and we just bring those electrodes down the needles. The tip of the electrode heats up, and that's how we are able to burn the sensory nerves to the joint. So thermal or internally cooled radiofrequency ablation can be used to denervate the genicular nerves. Both the genicular nerve block and the ablation is done under x-ray guidance, so that's how we know we're in the right place. And the target for the superior medial, superior lateral, and inferior medial genicular nerves is the junction between the femoral or tibial shaft and the epicondyle. So you want to make sure that the condyles are properly aligned on your x-ray in order to accurately gauge the depth of the needle. So you can see here, this is an AP fluoroscopic view of the knee. And our target for the nerve block in the ablation for the superior lateral, superior medial, and inferior medial genicular nerve is the junction between the shaft of the femur and the condyle. So you can see this little groove here is where we want to get our needle on the AP fluoroscopic view. The depth we're able to gauge from a lateral view. So this is the lateral view here. And you want to be halfway down the shaft of the femur, halfway down the shaft of the tibia, and that's how we know we have the accurate depth and we're along those genicular nerves to the joint. So does it work? There are randomized controlled trials that have demonstrated efficacy of radiofrequency ablation for denervation of the genicular nerve. One study was a double-blind randomized control study that compared efficacy of genicular nerve ablation to a sham procedure. And they did find a statistically significant decrease in pain scores in the radiofrequency ablation group compared to the sham group. In addition, they did report significant functional improvement and satisfaction with the treatment at a 3 months follow-up time. So if the ablation is successful, you're looking for at least 3 months of relief, sometimes 6 months of relief. It's not permanent because the nerves do regenerate, they do grow back, but hopefully very, very slowly. So if someone does do well with the ablation, it is something you're able to do every 6 months as necessary. So another study compared the effectiveness and safety of cooled radiofrequency ablation with a corticosteroid injection in patients with knee arthritis. So all of the patients in the study underwent a diagnostic nerve block to the superior medial, superior lateral, and inferior medial genicular nerve. And if the patients had a 50% reduction in their pain score, they were then randomized to receive either a single intra-articular steroid shot or to get the radiofrequency ablation. And they found a significant reduction in pain scores, Oxford knee scores, and global perceived effects up to 6 months in the cooled radiofrequency ablation group, and the procedure had no reported negative side effects. So safety of the procedure. So ablation is considered to be a very safe procedure. Potential complications do include bleeding, infection, pain at the procedure site, as well as skin burn. However, if done correctly, so if you line up your x-rays correctly and you verify that the electrode tip is deep enough in the soft tissue, skin burn really shouldn't be an issue. And although more research is required, radiofrequency ablation for alleviation of knee arthritis deserves consideration as a mechanism to reduce opioid administration and decrease pain and improve quality of life for a lot of our patients. Thank you.